With what could be some very good news in the fight against COVID. Today, the White House is announcing plans to make a pill for treating the virus available to millions more Americans. It could be a big step forward, but there are still considerable hurdles as well. Nancy Cordes is at the White House following it for us. Nancy, good morning. What's this all about?
This is about the Pfizer antiviral drug Paxlovid, Tony, which has been shown to reduce hospitalization and death in people with COVID by 90%. It's been in short supply until fairly recently, but now production has ramped up, and the White House wants to make sure that more people can get it for free.
I'm an individual who is high risk.
Ashley Ballou-Bonema tested positive for COVID on Easter weekend. As someone with cystic fibrosis, she knew it could be bad.
And in the world of CF, when we get a cold, whether it's, starts in our sinuses, inevitably it affects our lungs.
Her doctor prescribed an antiviral medication called Paxlovid, 2 pills a day for 5 days.
Within the first 24 hours, I really felt a difference.
Currently, Paxlovid is only available at about 20,000 sites around the country. But the goal is to double that within weeks by allowing participating pharmacies to order free antiviral treatments directly from the federal government.
To me, it's game-changing.
CBS medical contributor Dr. David Agus says the drug prevents the virus from replicating in the body.
I have seen patients of mine who, when I put them on Paxlovid, literally a day later, they feel dramatically different.
The FDA has only authorized Paxlovid for use by those 12 and up who have a high risk of developing severe COVID. But that's still about 60% of the adult population, including anyone with obesity, heart disease, or diabetes.
Even people who are eligible are not taking advantage.
They can by going to the government's one-stop Test to Treat website, where they can locate one of 2,200 pharmacies offering COVID testing, a medical assessment, and a free antiviral prescription, all in one spot.
And the notion that they can go to a pharmacy, test, and within 30 minutes, start a pill to fight the virus is really powerful, and I think is what's going to get us out of the COVID-19 pandemic we're in now and allow us to live with the virus.
Now, in order to work, antivirals like Paxlovid need to be taken starting within the first 5 days of the onset of the illness. And that's why expanding this Test to Treat program, where people can do everything in one fell swoop, is going to be so important. But the White House is warning this morning that if Congress doesn't approve its latest COVID funding package, that the government's ability to buy more Paxlovid could be in jeopardy. Gail?
Boy, we need as many weapons as we can to fight this thing. Thank you very much.